much for attending our webinar on celebrating World Environment Day and looking at health professionals supporting environmental efforts wherever they find themselves. Thank you so much. My name is Catherine Duggan. I'm the Chief Executive Officer of FIP, the International Pharmaceutical Federation, which is an organisation based in the Netherlands. A few little points of housekeeping before we start our webinar today. This webinar is being recorded and streamed via YouTube. The recording will be available on our website at www.events.fip.org. We'd really welcome you introducing yourselves via the chat button, and you can ask questions there or using the question and answer box provided. And we will be using your questions to guide us through the panel discussion a little bit later. We'd really welcome any feedback that you have provided to us at webinars@fip.org. And if eligible, we'd love you to become a member of our federation. Thank you so much. We have a new translation feature on Zoom. We'd like to instruct you how to use it. You can turn on the captions, you can enable the translation toggle, and then choose your preferred language under My Caption Language. And then you can follow along with live translated captions throughout the whole of this event. I'd like to make a few points of introduction about the World Health Professions Alliance. An alliance FIP was a founder member of. We speak for more than 41 million healthcare professionals worldwide. Formed in 1999, we celebrated our 25th anniversary last year. The Alliance brings together global organisations representing dentistry, dentists, nurses and nursing, pharmacists and pharmacy, physiotherapists and physiotherapy, and physicians. The aim is to bring global health professionals together, collaborating for a better health for all. The role of our alliance is to promote and practice interprofessional collaboration through leadership, advocacy, and policy development, to present a united voice for the healthcare professions, and to facilitate collaboration between our health professions and major stakeholders, such as the governments in our country, health ministries, international organisations, and that includes the World Health Organization. Chairship rotates between the members every year. Last year, I was the chair as CEO of FIP, and we spearheaded the revision of the statement on interprofessional collaborative practice. It's not enough to do it. You have to also tell that you're doing it. So that's really important to us. You'll see on this slide the logos of the organizations. Some recent activities that are related to the environment and climate change, which we are gathered here today to talk about, include interventions we delivered on climate change and health at this year's World Health Assembly last month and at WHO's Executive Board meeting in January 2025. We spoke at the WHO Global Congress on Air Pollution and Health in Cartagena in March this year. We signed the WHO call to action for clean air on behalf of the 41 million healthcare professionals we represent. We participated in a work stream, the contribution of health professions to the climate change and health agenda in June of last year, aiming to influence the UN Climate Change Conference in 2024. And that took place in Baku in Azerbaijan. And this year it will take place in Belém in Brazil. We have some policy statements on health and climate change, and all of our WHPA members, whether it's dentistry, nursing, physiotherapy, medicine, or ourselves in pharmacy, have environmental and climate policies for our professions. In addition, FIP has the FIP development goals, 21 of them, which were developed to align with the Sustainable Development Goals and built on our previously published pharmaceutical workforce development goals. They start with academic capacity, which is really important for our workforce, and they end with sustainability in pharmacy, which also considers workforce. But as we are here today to celebrate World Environmental Day, it's really important that we focus on sustainability in pharmacy, our roles with waste medicines and their management, our roles with air pollution and managing NCDs and patients and public health. We have several publications in recent years on sustainability, on many of the issues that I've just mentioned, and we'd be happy to share links with these for any of you who are interested. This slide showcases some of those reports, and we build on them year by year with policies and support for nations where they have those problems to implement. So back to today's programme, colleagues. I'd love to introduce you to our panel. Our panel is not only global in influence, as I mentioned, many of them are working in organisations such as FIP, so our footprint is global, but we're also speaking to each other from different countries. So we have Stephen Mulligan, who is based in Yorkshire today. We have Edward Krishanus, who's based in the US today. Clarice Delorme, based in Switzerland today. We have Philip Marich, based in Norway today, and Hedi Potter, who's based in Finland today. And this will provide us with a really nice overview, not only of the healthcare professions they represent, but also the countries that they are speaking for and from. The learning objectives for today's session are to discuss the healthcare professionals' involvement in medicines recycling initiatives, to highlight interprofessional efforts and initiatives that are positively impacting the environment, and to understand the impact that recycling can have in healthcare systems. There are lots of challenges that face each of our professions and face us globally as well as citizens. And it's really important that we share our learnings, the challenges, and ways in which we can overcome them. Next slide, please. So first in our panel, who's going to walk us through a presentation, is Edward Krishanus, who is president of the Waste Not, Want Not International organization based today in the USA. You're very welcome to join us, Edward.
Thank you very much, Catherine. And good day, good morning, good evening, good late evening to all those that are participating. Excited to be here, and thank you for the FIP for this opportunity. I have a brief presentation here. Do you have a minute? Healthcare waste management, 60 seconds. I've been in healthcare for 43 years. Yes, those are biohazard bags on my laundry line at home. You know, most of the time when we think about healthcare waste, we only think about infectious waste. The reality, there's quite a wide, diverse waste stream. Pharmaceutical waste is front and center in that. And whether you're looking at things related to antimicrobial resistance or disposal of these drugs or management, reuse, or redistribution of these products, there's a lot of different waste streams. So we really have to take a holistic view when we're looking at things. Do you realize the introduction of single-use products actually was in the early 60s, okay? And think about the wide variety of items that we discard today. Look at these modern technologies, these Abbott Alinity units and Kampala, 21st century technology, 21st century healthcare workers. Unfortunately, what we're dealing with is still 19th century disposal methods. We have large volumes of waste that are creating challenges everywhere around the world, not in low and middle income countries, but even high income countries. Here's an example, again, the diversity of the waste stream. You've got hazardous chemicals on the left side, guanidine thiocyanate. You have different types of point of care cartridges and specimen bags. Those are actually drugs. Those are pills that went through an incinerator, still came out intact. So we have a lot of challenges as well as not just the products, but the technologies that are being utilized. And we go from modern technologies, as you see this incinerator in the middle, to other ones that are old and need to be replaced. And we do have non-burn technologies, which are fitting into the environmental goals for the WHO and the UN. However, they still need to be properly managed and maintained. Lots of guidance, just like Catherine pointed out, fantastic number of resources at FIP as well as other organizations. But ladies and gentlemen, it comes down to people, products, practices, and there's a cost with this. And with that, thank you, Catherine.
Great presentation. Thank you so much, Edward. This will really spearhead our discussions at the panel. And I would just welcome all of my colleagues who are taking part in the panel to introduce themselves. So Ruben, next slide, please. Clarice.
Sorry. Hello. Thank you, Catherine, for giving me the opportunity to speak on behalf of the World Medical Association. So the World Medical Association is a global federation gathering more than 100 medical associations worldwide and representing physicians globally. We are member also of the World Health Professional Alliance and benefit a lot from this collaboration, interprofessional collaboration. In the area of climate change and environment more broadly, we've been very active for many years. In fact, we consider that physicians have an ethical duty to act in this area, in line with the pledge they take when they enter the medical profession to protect the health and well-being of their patients. So we've been acting for many years in mainly globally in terms of advocacy on climate change, but also chemicals, product management of chemicals products, air pollution. And we also try to promote and encourage our members to act in their countries and to exchange best practices between themselves. So thank you again for inviting us.
Thanks so much, Clarice. Looking forward to our conversation. Next in line is Philippe.
Yes, hello everyone. Thank you for the invitation to be here. It's really a great event. I'm looking forward to the discussion already. My name is Philip Maric. I'm an associate professor in physiotherapy at the Arctic University of Norway. And I'm also the founder and executive chair of the Environmental Physiotherapy Association that has been working for a few years now to really advance environmental sustainability and planetary health perspectives in physiotherapy research, education, and practice. And so this is where I'll be kind of speaking from. I'm speaking from from a base in the physiotherapy profession. I think that physiotherapy, by the way of how it functions and what it offers to patients, has a lot to say towards improvements in the environmental sustainability of healthcare. Our main intervention modes are communication, movement, and touch, and so they're relatively sort of like low carbon, low footprint, low medicine interventions, if you will. And so there's a lot that this profession potentially has to offer, and it's the background of which I'm coming from. Thank you.
Thank you so much, Philip. It's really great to have you with us today. And next in line is Stephen. Stephen, over to you.
Hello, everybody from Yorkshire, and thank you, Catherine and FIP, for the kind invitation to join you. I'm really looking forward to hearing the panel. My background is I'm a dentist in the UK. I've been researching and working within the University of Sheffield in Yorkshire, and through that, I became one of the founding members of the FDI World Dental Federation Sustainability Task Team. The FDI represents more than 1 million dentists worldwide in 134 countries, and aims to raise the importance of good oral healthcare and its vital role in securing overall health and well-being. We know that dentistry has a huge carbon footprint. We use lots of single-use plastics every day. We have one of the interesting studies that we've been working on is looking at how the carbon footprint of patient and staff travel is a huge contributor to the environmental impact of dentistry. And we know that ultimately a reductionist methodology of reducing the need for materials and transport through prevention is critical. And this is where the FDI has created lots and lots of resources aimed at the profession, primarily in the form of MOOCs and toolkits and interactive web pages. And as one of our panelists has already said, it's about communication and making that message loud and clear that we all need to come together. And to that end, I was the co-author of one of the first consensus statements on sustainable oral healthcare, which looked at oral healthcare as a supply chain. And that was taking into account that manufacturing to distribution to the use of products, and then finally their management of the waste is all part of a huge network of a supply chain that ideally we need to look to form a circular economy within. And I'm looking forward to hearing other colleagues on this panel, and thank you very much.
Thanks a million, Stephen. I'm looking forward as well. And I'm going to now hand over to Dr. Teddy Potter. Teddy, the floor is yours.
Thank you for inviting me to be here. I'm Teddy Potter from the University of Minnesota School of Nursing, where I direct the Center for Planetary Health and Environmental Justice. But today I'm coming to you from Finland at the International Council of Nursing. And I'm excited to share with you that just last week we put out a topic brief on nursing for planetary health and well-being. It has been sent to our 30 million nurses around the world. We're the most numerous group of health professionals in the world. And we are moving towards all nurses practicing from a foundation of planetary health as one of our core pillars of our profession. I look at my background here, and FIP is flipped, and I thought, oh, that's a perfect metaphor for nursing, because we're not content with the way things have always been. We're out pushing the envelope and saying, where can we go, and how can we champion the actions, policies, behaviors, and education that allow us to get more on a sustainable path. So again, I look forward to everybody's comments, and I look forward to the audience participating.
It's great to have you. Thank you so much, Teddy. So, colleagues, we ask you to use the Q&A tool. I'll also get the team to monitor the chat box in case there's questions there. But I'm going to go around the table and ask my panelists some main questions before we get to the questions from the audience. So, I'm going to ask this question of each of you. What challenges exist in your sector and setting of practice regarding recycling of materials, medicines, and often widely used products? How can we increase initiatives focusing on recycling from your professional perspective? I'm actually going to start with Teddy on that one.
Oh, thank you very much. I want to start with a disclaimer. I am a nurse, and I am here because of the ICN, but I'm practicing in the United States, which is one of the most leading polluters and producers of waste. And so I want to acknowledge our culpability as a nation, and that we have to activate our health professionals to stand on this. And so the United States, just as an idea, we generate huge amounts of waste. The U.S. healthcare system generates an approximate 5 to 6 million tons of waste every year, according to the American Public Health Association. Not just waste, but we also contribute. Our healthcare system contributes 8.5% of the U.S. greenhouse gas emissions is due to the healthcare system. And our U.S. hospitals generate approximately 10 to 15% of their 10 to 15% of the waste is related to food waste. So we've got a lot of things to work on in our country. The challenges are that a lot of our professionals do not connect the things that I just mentioned: food, products, energy, waste, to their profession. So we need to connect that tighter. They might ask, well, what does this have to do with the nurse? What does this have to do with the physician? And we're building the case that it has to do with everything that we care about. Historically, in our nation and many nations, unfortunately now around the world, the business of healthcare is growing, and it has had a huge impact on our selection of products, our use of products, and our sort of psyche or mental belief that we have to use more and more is better. At least in the US, we put a lot of energy into acute care, and that's a problem. We need to be preventing illnesses in order to get on top of this waste issue. And there's just sort of an attitude of time is money. It's easier to use single-use products than to sterilize and reuse. And we have a terrible, terrible habit in the hospital system that if a product gets into a patient's room, it cannot be reshelved. It is charged to the patient, even if it's never opened, never used, and wasted. So we've got problems. I hope your countries do it better than we do. We're here to learn from you, but those are the challenges, some of the challenges we face.
It's great to hear, Teddy. I think it's really important for us to be humble, both from the countries we work in, but also from a professional standpoint, and put all of the challenges on the table so we can have an honest discussion about how we might tackle these in future. Next person on my list for this question is going to be Edward.
Thank you, Catherine. You know what, as I've indicated, I've worked in the healthcare for 43 years. 35 of those years has been in healthcare waste management, and I've traveled to 62 countries. So my perspective is quite diverse, from the low to middle to high income countries. I think one of the recurring themes, and what I want to focus on, is we do talk about recycling of materials, and we talk about sustainability. Those are very simple words to roll off the tongue, but actually to do them is quite engaging and challenging. In fact, in many cases, you can recycle everything that is in front of you. Catherine, the glasses that you're wearing, as an example, you can recycle those. However, I need a certain critical mass. I need someone to collect them. I need them to go somewhere. Somebody's got to want them. And I think right now, I appreciate the enthusiasm, but there's a lot of steps up, because when you throw something into in a recycling bin, what does it take to actually get it back to another set of glasses? Are we going to reuse, remake, make them into something else? So I think it's important for all of us that are involved in this, with the boots on the ground. I think we need to do a better job of educating the realities of there's a lot of steps here, and look for some of the things that might be low-hanging fruit for recycling. Blue wrap, which is used in theaters around the world to wrap instruments, is actually being recycled. You've got projects, you've got some equipment in Wales that's being utilized to recover it. We have it recovered in the United States. There's other places in the world that are not using blue wrap. Why? Because it's expensive. So they use muslin. They still use metal containers, etc. So context is important here as well. But understanding where this material will go, and understand that you need a certain critical mass to make it cost effective. Because at the end of the day, as you saw, I said people, product, practice, and price. There's a cost associated with it. So that's my comment from Connecticut.
That's super clear, and I really love that. Product, practice, and price. Very, very concise there. Thanks a million, Edward. We'll come back. Obviously, there's a lot of learnings from each other on this call. And next in line is Stephen.
Just unmute myself, sorry. So I suppose the challenges within oral healthcare, as it always is we've got two priorities when it comes to using products that could be recycled, and that's basically compliance to regulation and safety to patients. They're the two sort of pillars of the use of products within oral healthcare. And it's interesting to know that an average patient appointment in the UK at the dentist will generate about 21 single-use plastic items, which, as soon as they become in contact with a patient or in a surgery, are designated as clinical waste and therefore have to be disposed of. When you scale that up in the UK, it's 720 million items of single-use plastic within UK dentistry. So what are the challenges? Well, first and foremost, we have the regulatory bodies that deem us to sort of be as safe as we can. So these things instantly have to be incinerated on that grounds. When we look at other things that could be used, and the COVID pandemic was a great highlighter of how much single-use plastic is used generally in healthcare. And we were looking after that point to see what could be used and recycled. So things like gowns, which can then be washed and laundered and rendered reusable. But then we need to look at the carbon footprint of the management of reusable items. So life cycle analysis is so vital in these areas to actually understand whether it's actually more carbon efficient to reuse items or to incinerate them as single-use plastics and single-use items. I think going back to the first comment I made, compliance and safety, we have to work with regulatory bodies and within our own sort of networks to sort of really understand the low-hanging fruits that Edward mentioned. We can get big gains by doing lots of little things regularly. And that's basically, it's a real tough challenge. And this is why I really appreciate listening to other sectors within healthcare to see what are you experiencing? Are you having the same issues? How can we come together to solve it? And just one last comment, just going to the glasses comment that Edward made. My glasses are actually made from recycled fishing nets, which is really cool, but they cost twice the amount of money as normal glasses. And this is where it comes down to another Edward's comments. it's about the price. So we need to make environmental sustainability economically sustainable as well.
Yeah, I think you're quite right. There's the price as in the cost, but also the price to us as well. We need to make it worth it, don't we? Really great. I think just a point of note, Stephen, I think the purpose of the wider alliance of these healthcare professions is to learn from each other. We can be very sector focused, or we can even be very building focused. So we think about what goes on in a hospital versus what goes on in a community setting as well. Whereas there's a lot of learning that we can do across our professions as we're learning right now. Next on my list is Clarice. Clarice, over to you.
Thank you. I will speak more on, from a global perspective, from WMA perspective, and actually it was already raised by Teddy for the UK. Is one of the challenges, the first one I see, is the expansion of global health and global health systems due to a combination of different factors linked to demography, economic, social, also the increase of medical technology. This leads to important increase of medical products, medical disposals and waste, therefore, which in turns increase the environmental pollution, and which needs to be managed. So I think this is one of the challenges. And the other one I see, which is really more global also, is that environment is not a very popular topic for many decision leaders. Addressing environmental degradation, climate change, and other issues related to environments require really a long-term, resilient investment. And you need a really long-term vision on this issue, and I have the feeling that there's a lot of reluctancy from many political leaders in this area.
Another really important point. I mean, Stephen, you mentioned the safety aspect versus compliance with regulations. And then, of course, Clarice, your point is well made about just how willing are governments to lean into this and to take it on board as a real practice development. Thanks a million. Last but by no means least in this round of questions and answers is Philip. Philip, over to you.
Sure, thank you. I think I'll keep it quite simple as far as this question around challenges is concerned, and it goes back a little bit of something that Dr. Potter shared to begin with. For me, kind of working in physiotherapy, but also seeing what's going on in many other healthcare professions, the fundamental challenge is the extent to which we understand or don't extend that actually questions of environment, of sustainability have something to do with us, have something to do with health, have something to do with the healthcare profession, regardless of which healthcare profession that is. I really believe that, we need very clear integration of an understanding of how health is always related to the environment into our professional identities, into our roles, scopes of practice, policies, etc. And so it's really there that I think the foundation needs to be laid. And once we understand how integrally we're related to health is related to all things environment, I think that whatever challenges there might be will be overcome much more easily. Thinking about also here of the numbers of healthcare professionals around the world, nurses alone with 3 million, and then some tens of millions of all us others. If all of those knew how integrally we're related to to environmental issues, I think we'd be in a very different place than we are today. Yeah.
Points very well made there, Philip. I think there's an issue here about in the area of sustainability, healthcare professionals need to not only understand what their work and their professional life can contribute, good and bad, but also that we are citizens of the world and that waste medicines, air pollution affects us and our families as well. So it's a little bit of moving just away from the profession first perspective, isn't it? And thinking about our place as citizens in society. I've got another question for you all, and I think that this is flowing very nicely from the points that you've all mentioned. And I think this is more of a positive issue. How can we increase interprofessional collaboration on this topic of environmental sustainability, especially when it comes to taking back programs of recycling of products and devices? So it's really looking at the practices, Edward, you started from, and then thinking about our roles in that. And with that, I'm going to get you to challenge all of us then, Edward, with how can we do a bit of the recycling from your perspective? And then the other colleagues can challenge or raise the issues for you. Edward.
What I would say is this. You have to go see this waste stream. I think we do too much presentations, discussions, documents. You need to go, and my colleagues know, I chair the working group at ISWA, International Solid Waste Association, on healthcare waste. In the waste world, you have to go see it. You got to go hear the equipment. You got to follow the waste streams, follow the materials, see what happens to it. Bring people from different disciplines. All of us should be on a bus going to maybe a waste energy plant, maybe a recycling facility. When you really see the destruction of the material or the recycling of the material, and last but not least, you may have to smell something that isn't always pleasant, because that's the reality of some of these things. But when you see these things, okay, I have a pen device on my desk. I have a Libre device on my desk because I'm trying to figure out how to manage these things. So you really have to go see it, hear it, smell it. I think collectively we need to take more action in that space.
Lovely. So become involved in it, not just
Absolutely.
read about it, but actually immerse yourself in the whole issue around sustainability.
Right. I love what Stephen said about the glasses. Fantastic. Okay. And I've got glasses on, and I have 3 sets that I don't want to get the lenses repaired. Just keep wearing them until I get hopefully not blind.
Yeah, lovely. I'm going to move to Stephen next. Stephen, how would you respond to that? And also, do you have any challenges for your fellow panelists?
It's a great question, because I think the question you said, how can we increase interprofessional collaboration? I mean, first and foremost, this is, I'm loath to say I've been in sustainability in oral healthcare for the last 6 or 7 years. And that was the basis of my PhD and work within the FDI. And this is the first time that I've actually sat on a panel with physiotherapists and nursing representatives and Edward's background. And I think this is the first of hopefully many. So I think this is a great opportunity where we can be united and, like you say, get ideas from each other. Going back to Edward's comment, and this is not a challenge by any stretch. I think we all work within busy lives, and I think what you say there, it's so true. Because we work in such a busy, patient-focused life, we rarely get the chance to go and follow that waste stream and understand it. A man comes in a van and collects it, and it goes away, and that's all we see of it. Thankfully, in my role in practice, where I treat patients, we do have waste bins, and we have got multiple different kinds of waste bins, which over the last few years, this has actually become, there's been more segregation from clinical waste, which is now seen as offensive waste, to stuff that isn't offensive and can be managed slightly differently. In only the last year, within dental practices, we are now managing food waste more effectively. And we know that food waste has a huge carbon issue, well, a methane issue, so to speak, because when it's disposed of inappropriately, it can cause methane emissions, which have a much bigger global warming potential. So I suppose what my not so much opportunities, I suppose, is what I'm trying to get at, is that we need to keep looking for these different ways we can manage within existing structures and systems we have. And then like we already heard from Clarice, this is not a short-term solution. We need to be putting these things into place now to see the impacts. But if we don't put these initiatives in now, we will never get anywhere.
I couldn't agree with you more. I think, Stephen, if you start talking to healthcare professionals right now about doing new things on top of what they're already doing, you'll see fatigue just wash over their faces, because everybody is still carrying a lot of exhaustion from the pandemic in healthcare professionals' lives. Whereas if you're doing something, even if it's small, just leaning into that means that you're going to be, I don't know, getting more value from what you're already invested in. So I think that's a really good point. And I do know starting from today, perhaps our challenge to each other is more of these would be useful. You'll see some of the feedback from colleagues on the call saying the same. I'm going to move to Teddy next. Teddy, what would be your comments on this area?
Thank you for the question. I would say in the whole field of planetary health, the whole area of planetary health, we're moving beyond multidisciplinary and interprofessional to transdisciplinary. So how does that differ? It means that the solutions that are required at the scalable speed that we need are not going to come from nursing. They're not going to come from physiotherapy. They're not going to come from dentistry. They're going to become when a nurse and a dentist come together, create safe space and a space for intellectual banter and examples and sharing. And out of that, the solution comes from the intersection of our professions. So it's pushing us in an evolution of these relationships. And it's very, very exciting. I do want to invite people to potentially come to the Planetary Health Alliance global meeting, which is going to be in Rotterdam in October. So if what I'm saying, and I'll put some sources in the chat, are exciting to you, I encourage all of you to come, because that is transdisciplinary. It's not just health professionals. I'm very oftentimes in a room, a nurse, a farmer, and an engineer, and trying to come up with the solutions that are necessary. The other piece that I would advise all of us to do is to not rank professions. Let's get away from this group is better than that group, and this is high, higher in a hierarchy. We don't have time for that, because what happens when one profession thinks they're better than another profession, what happens is the solutions or the pieces of the puzzle that come from that other profession are not listened to, they're not invited to the table. So we need to do that paradigm shift where everyone is needed, everyone is listened to and heard, and it's electrifying. So I want to invite all of you into the movement.
Great, that's a real call to arms for us, Teddy, as well. I love that. Nobody is better than the other. Enables us to stand shoulder to shoulder, I think, which is also a really good phrase. Lovely. Next on my list then is Philip.
Yeah, sure. Thank you. I mean, yeah, for me, this is an interesting question with this idea of interprofessional collaboration. I think I sit again with a lot of what Teddy has already said, but interprofessional collaboration has been talked about for quite a while already and worked on and researched, I'm going to say, for at least 3 decades. I'm not sure how far we've come. I think the reason for that is relatively straightforward. It's because even the idea of interprofessional collaboration still predicates the idea of professions. We still have to hold on to the professions so that we then have to generate interprofessional collaboration suddenly. So I think that's a little bit, if we were to challenge ourselves, let's challenge ourselves around the notion of professions and about whether or not professions are even the best way to organize ourselves, or organize ourselves around. I mean, even the World Health Professions Association is an association of health professions. But why should we be organized around professions and first and foremost be concerned with the kind of durability of professions versus the actual health and environmental issues that we're facing? Organize around those and find the solutions that are necessary in response to those. So I think that's really kind of like the space to think around. It's a very challenging space because how our professions are organized it has to do with how our societies are organized today. But why not look at some of the big challenges as well, rather than just the sort of like smaller things in our little spaces. So I think that's really where we can push, and planetary health is one such field where this is possible, and yeah, a lot of resonant developments there as well. But really a kind of a questioning even of the professions is necessary if we want to get beyond those silos and move beyond that kind of thinking and working.
Oh, lovely, lovely. So we've got the micro issues that we're looking at, the things that we're already doing, that means that we really want to lean into those so that this doesn't become an extra big burden on top of the professions themselves. And then the bigger way of thinking about it, which Teddy and Philip have mentioned, which includes taking a macro look at the whole thing. I would say, Philip, we've got a responsibility as healthcare professionals to really own the areas our professions are impacting. So maybe it's not all of our responsibility, but I think a little bit of ownership over it would be really, really helpful as well. But you can see that we're going to have to take both approaches, colleagues. So let's get engaged with that. Last but by no means least on this question is Clarice.
Thank you, Catherine. First, from experience, I would like to emphasize that, in fact, in the era of climate change, some of our delegate members, physician members attending the conference on climate change and other important environment events, all reported that physicians, and I think more broadly health professionals, have really authority. They have a credibility and legitimacy in when they speak and make the link between environment and health. And I think this is very important. And in fact, in our work on climate change, we work a lot with organizations specifically working on health and climate change. So they really dedicate all their resource, skills in this area. So they have, in other words, they have more time than us to just work on environment, if I'm really from a very practical point of view. And actually, they need us to really make stronger their case, while we need them in the fact that they really have the capacity to mobilize actions, people, and partners. So in that sense, I think that that's actually what Philip was saying, and Teddy and my previous colleague, is that I think I would really support some actions which are more transdisciplinary initiative, although of course I don't question the interprofessional collaboration, which is important, that we could develop as well through WHPA, of course. But both would be necessary, and that's the experience we have.
Yeah, I think, Clarice, if you miss any of those overlaps, you risk not engaging fully. So you need the interprofessional collaboration. You need to be professionally focused at the same time, but this transdisciplinary approach also seems to me to be very, very useful. Very good. Thank you so much. This one is a kind of like a short add-on question, if you like. I think we can do this one pretty briskly, and I notice there's one or two in the chat box as well. Are there any opportunities for tackling this via provision of and education of healthcare professionals? So do you think there's a role for education, or maybe even joint education for this kind of work? And I'm going to start with Stephen, because you just made the point that despite doing this for 6 or 7 years, this is your first collaborative event. So
yeah,
what would be we're going to do takeaway messages right at the very end, but what would be the thing that you would throw into the mix today that we could do collectively as the Alliance?
we're doing it already. We need to normalize sustainability. We need to talk about it. We all have colleagues that we work with within our silos and sectors that are either interested and don't know much about the topic, or there's people who are very passionate about it, like I'm going to assume a few of us on the panel are. And then there's people who don't really care, and that's thankfully becoming less and less. But then there's people that don't know enough about the topic to form an opinion. And I think we need to really just normalize the conversation on sustainability. And that's what I've been working with. And going back to the original point, how do we educate the healthcare sort of networks that we're in? I'm very proud to say that through the FDI, we have developed some really great learning aids and tools. We've done toolkits which allow dental practitioners to actually look to see what they could do and gain sort of accreditation in the form of a bronze, silver, or gold activities that are sustainable activities within the oral healthcare system. And we created 2, soon to be 3 MOOCs, which are massive online open courses, which allows education of the healthcare workforce. And I'm proud also to say that it's not just dentistry that's been picking up on these education tools. We've been working alongside cardiology colleagues within the UK who saw some of these toolkits and adapting them in some ways towards their clinicians. So let's normalize it. Let's talk about it. Let's interact. Let's engage.
Lovely. And as you say, some examples of how that's been done already will help the profession understand this isn't an extra. Clarice, I'm coming to you next.
Yes, we at WMA we're supporting a platform which is called My Green Doctor, which has been elaborated by the Florida Medical Association and which provides advice to doctors about green practice managing healthcare waste. But that's for doctors more specifically. And but otherwise, at the global level, I see a lot of quite not a lot, but a few initiatives from WHO in particular. They have a train the trainers toolkit on. It's more on air pollution, but I think could be, since everything is linked, useful also for. I mean, it's useful for all health professionals and actually other health actors. Yeah, there is the WHO chemical roadmap. Actually, there is several initiatives where we could, as health professionals, be more active. What we're trying to do at WMA is really to promote this within our membership and organize meeting and invite WHO to speak and present these toolkits. But this is maybe something that we could also do at WHPA level.
Very good. Very good. Very practical and builds on what we're doing already, which I think is just the magic win here. I'm going to go to Philip next.
Yeah, education is really the key in so many ways. So in the Environmental Physio Association, we have a project that's been going on for quite a while that now we have is actually joined by over physiotherapy departments from over 100 universities worldwide that are trying to get these topics into physiotherapy education. But I mean, it's really kind of education is really the grounds of all of it. Teddy and I and many others have also collaborated on the planetary health education framework that's available through the Planetary Health Alliance, alongside a lot of other kind of education materials there. For physio more specifically, we're constantly developing different educational tools, coming up with new ideas of how to integrate this into education, and from there working on how this changes what we do as healthcare professions. I can just sign under anything that says bring this into education. Yeah.
Lovely. Thanks a million, Philip. Over to you, Teddy.
I'm of the belief if you want to see it, go out and build it. And so we are threading planetary health content through our entire baccalaureate or undergraduate program, our master's in nursing program, our Doctor of Nursing Practice program, and our PhD program. Every single course has planetary health content. So our students are graduating ready to practice in a climate changed world and a world facing these issues. And so I would urge you, if you have administrators or leaders that are maybe not moving in this direction, get your students involved in the Planetary Health Report Card. It's an international movement of students. There's a medical planetary health report card, nursing planetary health, pharmacy planetary health report card, and it's student driven. They actually give us grades, and it can be leveraged quite effectively. So our medical school was just not moving in this space. The dean thought there's too much in the curriculum. We didn't want to go in this direction. So their students did the planetary health report card. And I took that information and I said to the dean of the medical school, well, congratulations. Last year you were getting a C minus. This year you're getting a C. That's on, the global internet. Everybody can see that. I hope you'll help us celebrate in the School of Nursing because it's our second year of receiving an A. And that really got him fired up and getting involved in this movement. So empower your students to reach out and figure out how to drive this change that they want to see.
Oh, that's great. That really pushes something very practical onto the individual. And then there's a whole wealth of resources, whether they be reading or interactive, for them to engage with. Edward, what's your reflection on this area?
Well, you know what? I really enjoyed some of the comments that Philippe and Teddy made, and even Stephen said it, silos. We definitely have to get rid of the silos. I would say there is so much, and I don't mean it in a negative fashion or negative way. There's so much noise on sustainability, waste management. It's fantastic, but each of us are picking something and hearing I like that note and I'm following that, and it's good. But somehow we have to come back and I think we're all talking about collaboration. I think for me, it's messaging is very important. Think about it. Somebody's walking away from you. Where are their ears pointed? Not towards you. They're away from you. They're not hearing what you're saying. They're not seeing what you're saying. I have probably 30,000 photographs of waste from all around the world. seeing is believing. Going out, as Teddy said, go out and build it. I think those are the critical things. I think it's really engaging in a lot of hands-on practice is a key component here. And educating young, and even before you even getting to nursing school or med tech programs or physiotherapy or whatever the case. And we know that that's happening. It's even happening in low and middle income countries, but the context is a little bit different. And we have someone that has a Q&A on management of sustainability of pharmaceuticals, I would say, maybe in the environment. So I'd love to, when we get to that point, comment on that as well. But I think that's the key thing here. It's messaging and clearly collaborating across all expertise, all the career people that we have in healthcare. That's a critical thing here.
Thank you so much, Teddy. Sorry, Edward. I think I've got a really big steer here that we don't need to reinvent the wheel. We really need to push people to where the resources are. And maybe push is a bit too of a strong word. But you just mentioned the question we had in the Q&A box, Edward. I'm going to start with you on that because it flows very neatly from the question, from the answer you just gave us. And of course, this comes from a pharmacist perspective, but you can relate it to anyone. But as pharmacists in low to middle income countries, how can we lead by example in sustainability efforts within our communities? I think in high income countries, we have the benefit of exactly that, the income levels, but maybe in low and middle income countries, the challenges might be different. Your thoughts, Edward?
Well, this is interesting. I've actually been involved in disposal and management of pharmaceutical waste in a number of low and middle income countries in Guinea and Ethiopia, Tanzania, et cetera. So I've got a little bit of a working knowledge there. And in fact, many of these low and middle income countries are looking to programs like what you have within the NHS or what you have in Spain with SIGRE. You have collection of pharmaceuticals in communities in France. Okay, so they are actually looking to implement these programs. I know the Ethiopian Pharmaceutical Association, it's not called MFHACA. There are resources out there. Catherine, I would say the biggest challenge here is the implementation. I think that goes with a lot of the things that we're talking about. We've got great guidance, videos, but then who's going to get on and I like to say lead, follow, or get out of the way. And the problem is, who wants to lead this? So the implementation part is challenging. I will tell you, I've worked with many pharmacists around the world. They're aware of it. But what's the next step? So the resources are there, and people want to get rid of these things. Pen devices, okay? Novo Nordisk has done a great program with pen devices in Denmark, and we're seeing that in other parts of the world. So I think there are resources. It's the leadership within those countries that are saying, let's do this. Let's take it forward.
That's great. I'm going to move to Teddy next.
So, excuse me, I think it's really important to recognize that keeping people healthy is the greatest defense we have against harming the planet. So our efforts need to work together to keep our citizens healthy teeth, healthy bodies, healthy minds, healthy spirits. Is really heading in the right direction. And I want to call attention just to the whole idea that as health professionals, we're the most trusted professions year after year after year after year. Nurses, physicians, pharmacists, we're all there. And so when we speak about the importance of recycling, reusing, and reducing to our patients and the people we care for, they do listen. So let's leverage that.
Very good. You can see we're now focusing on your one key message, which will be the next question. So I'm going to go to Stephen next.
So apart from my other message about normalizing, are we talking about the LMIC question? I'm sorry, forgive me.
We're talking about the LMIC.
Yes. So my knowledge of pharmacy in LMICs is difficult, but having worked through the consensus statement with different healthcare organizations in LMICs, it comes down to obviously funding. It's money which comes down to it. And the sad fact is that LMICs are ultimately negatively impacted more through climate change through HICs, which is a bitter irony in a lot of ways. when we look at the Conference of the Parties, the COP delegations that we've had recently, I've seen a shift from, over the last few years, talking about how do we reallocate funding to these LMIC countries to incorporate these initiatives. And I think that's ultimately where it's going to come from, when we can actually fund these infrastructures for disposal of waste. One example from dentistry, which I'll very briefly say because I'm aware that we're almost on the hour, is that dental amalgam, which has mercury as a constituent, is up to 50% by weight of mercury, which when it's in the environment can cause, very bad events when it's methylated. And this is sort of highlighted by the Minamata crisis that happened in the 1950s in Japan. And then this is the base of the Minamata Convention for getting rid of mercury from the environment. And dentistry is one of those examples where we're trying to get rid of it. It's very hard to get rid of dental amalgam in LMICs because it's a workhorse material. It can be used in communities where they don't need many sort of sundry items like light curing units to polymerize advanced materials. So what's happening is the Minamata Convention is trying to phase out mercury, and that would impact LMICs profoundly. We need to sort of look to how we can engage with our LMIC clinicians to use alternative materials. And that again comes from funding, perhaps from manufacturers subsidizing the use of this material in those countries.
That's super. Thank you so much, Stephen. And don't worry, I'll manage the time. We've got the one key takeaways, but I've had one from each of you already. So we'll see where we get to. Philip, I'm going to you next.
Look, as far as LMICs are concerned, we really work kind of around the globe with the Environmental Physio Association, and the interest and willingness to work on these matters is just as high as in LMICs as in other countries. What it comes down to, for the most part, as far as I can see, is just this kind of, the level of awareness from which can grow a level of willingness or something like that. So really working on that kind of if I transition directly to my one takeaway message, it's really, we need to increase awareness that about the fact that environmental sustainability, planetary health, etc., are not matters of special interest in our professions, but an integral component thereof, right? And that by becoming more aware of the interconnections of health, environment, and society, will be able to much more naturally and kind of as a matter of course contribute to these very transdisciplinary matters. Yeah.
Wonderful. Thank you so much, Philip. And last but by no means least on this question is Clarice.
Thank you. I think everything has been said. I would just like to highlight what Edward and Philip said about implementation, and the fact that in fact actually, for example, at the COP on climate change, there's a commitments for low and middle countries, but the problem is the translation of these commitments into actions, really. And with behind this, there is the old investment issue, and from what I said just at the beginning of this event, the fact that environment, climate change are not popular issue makes it even more difficult, and it looks like it's not always a priority for many countries, whereas it should be, because actually everything is linked to environment and health. But I'm not going to develop that because it's a bit too long now, but I think you get the point.
I think, Clarice, you set us up beautifully for another event, which I am noting would probably be a good one. Ruben, I wonder if you could just share the slides, and I'm going to pull us to the summary that I've heard from my amazing panel here. I've got words that will help us with our concluding remarks. Normalizing, implementing, a move from interprofessional collaboration to transdisciplinary working, engagement, empowerment, and a move from awareness to willingness to act. And that was a summary from all of the panelists in various points at which they answered questions. So I think that provides us with a really useful set of conclusions. I would say, from my team's perspective, we would really welcome a continued discussion, perhaps a programme of events where we might focus step by step on how to manage all of these areas and progress on how we have managed them. So we move from challenge to delivery, which I think would be really psychologically helpful for the entire alliance and probably more widely as well. Next slide, please, Ruben. I just want to say we've got lots of digital events. If anybody, I know obviously we are the Federation for Pharmacy, but if anybody would be interested in them, you're very welcome to explore on events.fip.org. And then we have got, next slide please, our Congress coming up. And I know that all the organisations represented here have global congresses. Ours is 31st of August to the 3rd of September this year, and we're in wonderful Copenhagen. And I think somebody should write a song about that. This is the Congress information. And then I'd just like to move us to the final slide, where I would say thank you to the 101 participants who were attending when the numbers were highest. Thanks a million to my amazing panel, Teddy, Edward, Stephen, Clarice, Philippe. And thank you to my team, Afina and Ruben, who have stewarded us superbly. We're a minute over, for which I apologise, but I thank you all so much for your contributions. Have a great day, and thank you to all who've been listening.